Elotuzumab SLAMF7 story is an interesting one in myelofibrosis. It used to be thought that bone marrow fibrosis is a reactive phenomenon, that it's not really that important. But however, work from our group actually started to change the thinking around this 5 years ago when Dr. Verstovsek and colleagues from MD Anderson published that the bone marrow fibrosis is driven by or caused by cells called fibrocytes, and these fibrocytes are actually clonal. They are neoplastic. They are part of the malignant clone. And this is why you get the bone marrow fibrosis. It's not a reactive phenomenon. So, and then these fibrocytes are actually derived from monocytes. And so that sort of set off this path of investigation, if you will. And then Japanese colleagues, they've published twice now in 2017, I think, and then later in 19, that these monocytes that give rise to the fibrocytes could be targeted by elotuzumab, which is a monoclonal antibody against SLAMF7. And this is already used in multiple myeloma, a very safe drug, effective drug in that setting, although in myeloma it's used with imids and dexamethasone, not on its own. Anyhow, so this provides an avenue to target these monocytes that are responsible for the fibrosis ultimately by giving rise to these fibrocytes. So this study is an investigator-sponsored study, small study. We've just started. We've got 4 patients enrolled, looking at 15 total. And the idea is patients who are not candidates for JAK inhibitors, right? Those who are not candidates for JAK inhibitors, often due to cytopenias, lack of splenomegaly symptoms, etc. We're trying to see if we can intervene with this drug and lead to some reversal of that bone marrow fibrosis. Now, one thing is that because of the correlative studies and because of how the science has derived, we are restricting this study just to JAK2-mutated patients at this time, not CALR or MIPL. Again, this is more to stick to the science and how the concept was derived. It's not to say that the drug could not benefit the other mutations. But yeah, that's where we are. This is a trial in progress. It's early days, but it's based on a very interesting and novel concept.